Sift the flower. It's actually Sir Mix-a-Lot off his like first CDs. Baby You Got Back, you've heard that song maybe?
Yeah,
it's one of his popular ones. Yeah, Posse on Broadway. But that's a lesser known, like it's Buttermilk Biscuits. Yeah, I just like that. It makes me laugh every time I hear it. Yeah, we were talking earlier about corporate dentistry, right?
Yeah.
We're coming at it from different eras, really. I'm private practice, been doing private practice for a while. We're still private, we're not corporate, but we're competing with corporate, entities. You're just going to be coming out of residency, looking at all your options. So you're coming at it from what's best for me, what's best for my friends kind of deal. We're trying to compete with these guys. We still need, an associate. We're trying to compete with the corporate world now for surgeons coming out.
Yeah.
It's a lot. It's different.
What have you seen as far as that competing goes, in your own words,
We have a group practice situation. We have five surgeons and 4 locations. And so we were looking for an associate leading to a partner for a few years. And it's just really difficult to find one, believe it or not, because we're competing with the Aspen Dentals and the whatevers, giving you what look like huge contracts for starting out surgeons. And
Right.
You've seen them. I've seen them. And so I think it's been difficult. So trying to find someone who still wants to be in a private situation with the pros and cons of that versus corporate.
Yeah, but you got to hope that some people are willing to accept some responsibility. It's got a lot more upside being in a partnership position. And you're not just going to walk into a practice and be a partner, right? You're going to have a 1 to 2 year window of opportunity, and you could prove, do they want you on the team here versus, maybe they have better interests somewhere else. And yeah, it's a tryout. That's normal. And then once you have that responsibility of a private practice, your name's on the board, quote unquote. But you're going to make a lot more money on that partnership. You're not going to make more than 35-40% from a DSO. But as a partner, you're going to be making 45 to 55. Am I wrong?
So it depends on what practice you're going into. If they're really like super efficient and their overhead is, below 65% or whatever it is, you could be making, I don't know if you even know if it's close to that though, but maybe. But it's tough. It's tough. Costs have gone up since COVID. Just employee retention, like most of our expenses are employee related, meaning their salaries, their compensation, their 401ks. That's the biggest part of our expenses is staff. And that's shot up since the pandemic, really. We've had to pay people a lot more for the same work. And then I think that's just not our practice. That's a generalization.
Probably across the
and
board,
so I think it's kind of hit practices kind of hard. I know there's all sorts of people that watch or listen. DSOs are like basically they're called dental support organizations. And if you think about it like in medicine, like let's say 15 years ago, you want to see an ophthalmologist, right? There's private practice ENTs, right? You go to ENT clinics somewhere. Now pretty much all those entities are affiliated with some mega group, right? So in the Seattle side here, we had, for the longest time, there was this hospital chain called Group Health. They got bought out a few years ago by Kaiser. And Kaiser was real big in California, coming up north to Oregon. Now they're in Washington State. And so they bought all the Group Health. Now it's all Kaiser Permanente.
Yes.
Similarly, we had, Polyclinic here. Now it's Optum. A bigger group bought it. So there's really no private practice medical specialties anymore, for the most part. Even family medicine. If they've been incorporated into these entities, right? You used to think about going to a family medicine office somewhere, some local private practice dude. Now they're not really around. It's all corporate. So
Yeah.
I think that's the trend with dentistry. So all these private practices you're seeing are going to be bought up. They're going to want to sell. Technically might get some more money from selling to corporate. So they'll be bought up and kind of into a bigger group.
So how do we get to this point where there's such consolidation? They love to use this word. There's a lot of consolidation going on. And what is consolidation, right? You go from an abundance of practices, and then it starts to consolidate, become more condensed, if you will. But essentially what's going on is that, a big entity that has a lot of backing financially buys up all these little satellite offices, just like those major hospital systems were able to do. The major hospital systems were able to do it with private equity backing. It's the finance guys. The finance guys say, we're going to give you all this money, and we want you to use it and give us it back 5, 10. But yeah, they're making back 5 to 15 times their money or something like that, right? And that's the whole point of investment banking and private equity groups. You dump your money in, and within 5 to 7 years, you get your money back X-fold, right? Better than stocks where you might somehow hit a home run. And
you get a better return, and it's with medical dental stuff, it's more stable.
Exactly.
Right.
Exactly.
It's not, you're not like going down like the tech industry. People need this treatment So they're oftentimes going to have to get it.
Right.
So
Exactly.
you're right.
There's always people that need another tooth filled or a crown or root canal or extracted in our case, right? So that's why the business is very lucrative. There's always a need for it, and that's why it's a very safe business to be in. And then they can exploit it to get 5, 10, 15 times back their money. But how does this consolidation occur? So they buy up all these offices and they say, we don't really need to be renting out that real estate. We don't really need to be owning this office anymore with that staff and this. And just over time, you go from 52 offices to 37 or, whatever the numbers may be. These are just round numbers. But then you have less offices, same amount of or maybe you chop off some dentists that are producing the least. I've heard of DSOs doing that too. So you get down to the numbers of where just the biggest returns are, right? So that's how we get to that point. And then that's say within 5 years, right? Then they trim the fat a little more. Next, they look internally. So how can we get the implants for 40% off or more?
Yeah.
How can we get our materials, our dental stuff, the electricity, the rent, whatever it may be, the insurance? That's the next thing they do. We need to use these now 165 offices that we have. We have millions of patients between all.
They can leverage that to get better medical insurance for their employees, better rates, so they're paying less for all that. Yeah. They're paying less for, instead of like a private practice buying 15,000 implants in an order or two, they can buy like 10 times that much and get a way better deal from these, implant companies.
Implant companies, the insurance companies, the treatment insurance companies too. I know a general dentist. This is quote unquote literally what he said. He said, a couple of years ago, I was getting $750 per crown. The guy across the street from me is getting $1,250. So now I go to the insurance company and say, why are they getting $1,250 for their crowns? Why am I only getting $750? We got to even this out a little bit. And then they say, well, show us your patient pool, show us your books. Essentially what it comes down to is, do you have enough offices and patient population to leverage that against the insurance companies to haggle with them and get a higher reimbursement for the treatment you've already rendered versus the guy or girl across the street? This is how monopolizations form. They form these relationships. They have increased fees or decreased fees if they're buying products. Their overhead goes down and their income goes up even more. This probably goes in the second or third cycle of their vesting portfolio of fees. So not the first year when they all these up, the second.
Right.
Just my hunch.
What you said is correct. The other thing at the same time that's been happening is the tuition costs for schools have gone way up. I just looked this up today, actually. Like the highest costing dental schools, right? UOP is a 3-year program. It's like $125 a year, $121K a year, not counting living expenses. NYU, NYU, it's pretty expensive, right? Probably $100,000 a year plus living expenses in addition to that.
Yeah, like 125.
Right. And so that's 4 years. And let's say you want to go to an oral surgery program afterwards, and you're not going to get paid much in an oral surgery program compared to your cost of living. And then you got loans you got to defer if you have loans from dental school. Or if you go to a 6-year program, now you got another med school payment coming up for a couple of years of med school on top of the 4 years of dental school and the low stipend you get from your residency program. So you still may have to get more loans if that's the case, right? Unless you have a benefactor or something, or your parents or whatever. But for a lot of people, that's a lot of loans. And by the time you get out of school, you're like $600,000 in debt sometimes now. I can't imagine. Like when I got out, it was like, $200,000-$300,000. By the time you pay all that back though, with the interest and the years and years, you're paying like triple that. So you have that huge loan burden coming out of school, and you look at these corporate contracts, like let's just say in oral surgery, Aspen's offering or somebody's offering like $700K to start. Then you look at all the fine print. You got to get your own assistant. You got to do this. There's a service fee of 10 to 15%, whatever it is. And this private practice is going to offer me like, a base salary, let's just say of $300. And then there's some sort of production bonus in there. I would say for the most part, you're probably going to get paid more in a corporate structure coming out, I would think, for many groups in the country.
Just because, your piece of the pie, if you have the piece of pie, your piece is going to get bigger and smaller. If they sell a lot of practices this year, then it consolidates the number of shares and your equity becomes a bigger percentage. If they buy 50 practices in that year, all of a sudden, you didn't see this, but in left field, all of a sudden your pizza pie slice is so tiny and your equity percentage is smaller. It can vary, and you can't always time that, especially if you're just an employee in the structure.
In our situation, we have a private practice. We are fast tracking our associate. Normally, like when I bought in, I was an associate, I think, for like almost 2.5, 3 years before I was allowed to buy it. You were doing a couple years at least associateship in place. With private practice, you still have, I think, a bigger ceiling, but that's if your practice is also efficient. again, we're competing with corporate people. Like we couldn't find an associate. We interviewed people, like the interview pool was less. VA just kind of did a little write up on this like a couple of years ago. They said most dentists are going corporate when they get out of school. So that trend is there. And so we're competing with that. But yeah, I mean, that's a lot of money per year for school. I can't imagine, paying that much back if you have to get all that in loans like I did. But, and then having to look at your contracts and go, yeah, I can go to a DSO and get this much more than if I go to this private practice. And that would make the decision kind of hard, for private practice.
Yeah. And I mean, it's immediate gratification.
I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me.
I'm astounded every time I talk to a dental student just about basic finance. It's like, well, what about getting a salary versus getting a percentage? Which one do you want and why? And all these places, they'll give you, it's usually like a 2-year contract and they'll give you 2 years of a salary. And the salary means that however much you produce, whatever you do, you might come in 1 day a week, you might come in 5 days a week. But a salary means you're guaranteed this base salary by the end of the year. A percentage means that every piece of work that you do, you get a percentage of what is collected usually, right? Usually, sometimes it's production, it's usually collections. That's, what you produce is what you put into the practice. What we collect back is what we collect from the patients and the insurance company. So the salaries, the percentages are usually based off that. If you're going to be bringing in $1 million a year and you're going to get offered a 40%, of collections, that's the same thing as 400. So if they're guaranteeing you a 400 base salary, it doesn't matter. That's the same thing. But if that 400 base salary goes away after a year or two, and you're only getting that 400, what if it's 30%? That means that if you produce the same money, you're only going to get $300,000. So you're actually making 25% less that year if you produce the same exact number. This very basic finance, just dental students don't understand that. They're so in the periodontium. I don't know what the heck's going on.
Well, I mean, that's the other thing they say about DSOs. Like, you concentrate on patient care, we'll take care of the business part.
Oh, they love to
We'll
say,
take care of the HR, we'll take care of this. And, I mean, part of that is nice to hear because it's like that's some of the heartache is like, hiring, firing, and all that kind of stuff you have to do if you're an owner. But again, you're right. It's just like, if you sell to a DSO, let's say they give you 70% up front, your whatever they value your practice at. And then they hold on to 30%, you put it in the stock or equity or whatever. And what if, like you said, what if they have a period where their costs go up, they have staff issues, your production's going down. Again, you have that 10 to 15%, in a lot of cases, some maintenance fee they charge you. So you have to produce more than what you were doing to cover that 10 to 15% maintenance fee that they put on there. And so you could still be hurting, but it's nice to get money up front. I get that. Because the old way of doing is you work forever, and then when you're ready to retire, you sell your shares for whatever they're valued at the time, and you try to find somebody to take over and pay you for that. Now it's like you can sell to a DSO, and they'll pay you right away. It's pretty easy. And then I can retain 30% and work for you guys for 3 to 5 years, and blah blah blah. So it's different. It's different.
Oh, it's so different. I just wanted to round out the edge on that one topic real quick. Yeah. Many times, so these students are taking that for that what I'm calling instant gratification because they want that high base salary. So in that instant, they'll offer like a base salary of $500,000, but they're only going to give you 30% of collections. Versus a private practice, the private practices I've seen marginally, but a little bit higher percentage, and the base salary is significantly lower, right? So that's why these students are taking this. They see this fat number and they're like, I'm going to take it, but it's instant gratification because it's high salary right now, but after 2 years, it's going to drop significantly, right? And then just to put the cherry on the top, they'll say, yeah, we're also going to give you a $32,000 signing bonus if you sign right now. And then they lock you in, you're fixed for 2 years. You can't get out because of the restricted covenant. So now the red flags start to accrue after about a year or two. And you can't make your rules because you work for them. They don't work. Yeah. I'm sorry. You were going to say that's just like...
It's tricky. Like, depending where you go, like, they're going to be working you a lot. And so depending on your work-life balance, like, obviously when I got out of residency, I had loans. I'm like, I need to work. I'm like, by the time I got out, med school, residency, I was 32. I didn't take any time off. I just went boom, 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 boom. I'm like, I need to work. So I was happy working. But you also need a work-life balance a little bit. So private practice and all of us work about 15 to 16 days a month, I would say. We do well with that sort of work-life balance. And so, with 5 surgeons in 4 locations, it works out really well. So just depending on where you're getting into, some people are in a practice where they work 5 days a week or even on Saturdays and stuff. I'm like, I can't work Saturdays, but it depends what area you're in, if that's the thing, right? But yeah, but if you're in corporate, you could be working 4 or 5 days a week every week. They give you barely any time off or whatever the basic time off they give you. They don't give you a ton of time to study for your boards. Like little things like that all kind of make a difference. And the other thing is, let's just say our associate, he buys in this year. Now he's a partner. So he's got to buy in. He's, usually you get a loan or something and you buy in. And he's a partner right away, right when you sign up. And then let's say in 3 to 5 years, we all as a practice decide to sell to corporate. At that point, he's an equal partner. And so he would get his share of our valuation, a buyout from the corporate, and he could do his 3 to 5 year work time. And then he's free to go maybe wherever they have another practice. Like say he wants to relocate to Southern California and they have a DSO affiliated there that he wants to work there. That's fine. What if he joins another private practice then, does the same thing or starts his own and then sells again? It's a weird time. So I feel like you're young enough where it's still kind of like in that flux where you could do that again and then get a buyout. If you plan it right, I feel like if you got to look at all your options now, it's different.
Yeah, but the stars, there's like 7 stars that have to align both times in order to do it. You're 100% correct. Theoretically, you could do that. You have to be an expert marketer.
But I think enough small practices are selling, and the trend, let's just say there's 200,000 dentists in the country. 8 or 9% are corporate in like 3 years ago. 2 years ago, I think 10%. And now it's like 13%.
Oh, it's even more than
corporate.
That. I'm
so
sure
like every year it's going up, right? That are corporate. And the biggest people that are in corporate are the young dentists coming out of school. So the older ones are retiring. A lot of them are selling to corporate. And then the new ones coming in, a lot of them are going into corporate. So it's both ways. You're kind of burning it at both ends. I know a lot in our area. And a lot of times you don't even know. Like they make a deal. They don't really change anything in the office. You don't really know, until someone tells you or they
unmarked
tell you.
Offices.
Yep. So you really got to have a conversation with your surgeon there, whoever you're working with. Like, are you going to plan to sell when I'm an associate? Like, what's the deal? Like, you got to have those conversations, man.
Right.
Because they could screw you, right? You could be thinking you're going into a private practice. You're going to be a partner one day in this practice, and they end up selling from under, while you're an associate, getting all the full buyout, and leave you as an employee of this office, basically. Yeah. So these are conversations you got to have with people.
100%. That's why I took a long time to get in my contract that if the practice I sign with is going to sell to a DSO, that I'm not going to be a part of that deal.
You got to have it in there. You got to have wording in there, something to that effect. Yeah. And that take away your non-compete, whatever the rules are in your state. But yeah, that makes total sense. Do you know any horror stories from DSOs, from people that have been out?
So many
no names or anything.
Yeah. They'll say, oh, you're only going to work 4 days a week. Yeah, but each of those 4 days a week, you're traveling between 30 to 90 minutes away to all these separate practices. Once you get there, you're working 10-hour days. And look, that's great. If you really just want to do it, make a lot of money, you want to clock in at 8 and clock out at 6.
Some people do, and that's fine.
A ton of money doing that.
Yeah.
But you have to understand the injuries you're going to accrue over that time, the stress, the pressure, the lack of time spent with your family. And, and that's not coming off as complaints. It's just that there needs to be a certain balance, and also your responsibility to your staff and to your patients. So I think it skews the balance. It's a dangerous situation. And then you have other DSOs where the restrictive covenant is a radius around the practice that you can't work within for a couple of years. So yeah, you wanted to leave and start your own practice or buy into something across the street, but you have to make sure you're not in that covenant. Otherwise, you're going to get sued beyond belief. Could you imagine that? 2016, Long Island, this guy, he got sued and he couldn't practice dentistry for 2 years. He was sitting on his ass. This is the stuff that's some horror stories I heard of it. Crazy stuff.
If corporate wants to sue you, they have the money to do that generally, versus someone in private practice suing you for a covenant. That's a big pain in the butt. And I have nothing against corporate. Likely we're probably it's going to sell at some point, to be honest with you. It's just, it all has to do with the business part of it and things. But we're also not going to screw an associate over. We're not going to bring somebody on and try to sell while they're an associate just so we get more of the money. And I think some people do. So you got to have these conversations with your employer. If this happens, what's going to happen to me? You got to have those conversations with people. They're awkward, but you got to have them, because Otherwise, a lot of times you're going to get screwed, man. It's just part of it.
I do come from a very biased standpoint because
Yeah.
when I was in undergrad, I shadowed all these dentists and they all owned their own practices. And
Yeah.
you know what? They were all really happy. I met them at the gym. They all worked out. Yeah, so they were all like awesome, and they took me under their wing, great mentors and everything. And pretty much during dental school, they all basically sold all their practices to DSOs. And now they all became employees, and they all got the greatest deals because the people selling the practice get the highest percentage and the payout, the equity. Everyone that buys in or, works after that they hire to work in that office after has a lower percentage, has
Right.
lower equity. They're just the employees, and you have no strings attached to the practice really financially. For like, you don't get a nest egg like when you want to retire one day and you need something to sell, whether it be the practice, the real estate, or your equity in the company. That equity fluctuates. So I guess I'm saying I am pretty biased, and I think we're really tipping towards corporate. I think we're pushing 30-40% in the coming years, maybe even already in it.
And it's a lot like the problem is when these groups get into these corporate situations, a lot of times they're referring to their internal network of surgeons and specialists. As a private practice office like we're going to see some referrals drop because now those other offices have become corporate. They're like, you got to refer to our oral surgeon or our periodontist for this, right? So you're going to get into that stuff, and that's going to be a problem. And it already is starting to be a little bit of an issue.
I'm hearing it's an issue, yeah.
And so you can't fight that. Like, what are you going to do? Like, when your referrals drop. The other thing that's happening at the same time is, like, for oral surgeons is a lot of dental offices are just contracting out with their own oral surgeons or periodontists, right? They don't have one in-house, but they come like once a week or whatever they want to arrange it 4 days in a row or whatever it is, and they do their cases there. And so instead of them referring their wisdom teeth to you, they're keeping them in-house and they're contracting out with the neural surgeon that rotates around or somebody like that.
Periodontists.
So yeah, periodontists do that a lot. So that we've seen that more and more in our area, and so that's also part of it. And that's not necessarily DSO, but it's another layer on top of, referrals going down.
Yeah,
So it's all
and I
business.
think the dental anesthesiology specialty now coming out, it allows them to provide that level of care. So now there's really nothing as far as bread and butter into alveolar oral surgery done by general dentists, periodontists, oral surgeons. It allows them to keep 100% now in-house if they have a big enough network, like you said. So it's something to be concerned about.
I mean, this is all this stuff is happening at the same time. Tuition costs for schools, referrals going down for what we just talked about, also corporate stuff. And so it's just kind of hard to figure out the lay of the land, what's going to like shake out here. But it doesn't look great for private practice.
And the monopolizations, the ADA is allowing these monopolies to form where, with that insurance company, the big DSO with a million offices can get this payment, but the private practice can only get 75% of that. And that's how the monopoly forms, because they're making buddies with all the higher ups over here and there, and it prevents the little guy from on the way up. The only way they win, it comes down to personalized patient care and personalized referral and relationships between the general dentists, the referring doctors and stuff. But the one thing that I haven't heard people talk about is what is best. Is it better to be corporate for the patients? At the end of the day, is it better being corporate or is it better being private and more personalized attention? You hear all these patients, they say, well, every time I go to that orthodontics practice, I see it a different orthodontist every time. I see it a different general dentist at this dental office, right?
Right.
The majority of patients are very sensitive and have anxiety with that. I think most people would agree. They want to see or have a relationship with that dentist that they're working with, right? So there's the specialists and stuff, but if the specialist does a good job, they're going to go back there for that implant. They're going to go back there for the next tooth that needs to come out.
My medical doctor, my primary care is in a corporate clinic. Like it's a big mega clinic right now. And so like within the past 5 years, I think I've gone through 3 PCPs because they've moved on. Like it's like, oh, your doctor's leaving. Here, you got to find a new one. 3 of them in like 5 years. Like it's so fluid with the corporate, like people moving in and out. Same thing with dentists. Like you go to Aspen Dental or you go to something, it's like you're going to see a different dentist. They might be there for a year or two. They're going to move on. Yeah. So it's in the level of care. I don't know. Like, I don't know how in depth they want to get like with their treatment plans. A lot of times it doesn't seem like it's a lot. Like they're not doing like, the full veneers. They're not doing like the full fixed cases or just, bread and butter, which is nothing wrong with that, but it's a different level of care.
Yeah,
I think there's a lower ceiling sometimes with, what they want to do or what they're able to do in that structure. Like they don't, maybe the corporation doesn't want them doing these cases because it's not cost effective for whatever parameters they put there. I don't know. So yeah, it's tricky. And I think we're in a weird flux where there's some corporate, some private. It's just the relationship at some point is going to get skewed,
Yeah.
the other way. And so you kind of have to figure out where your practice is going. If your referrals are going to drop because of it, and what you got to do. A lot of it's out of your control.
Yeah.
Yeah, it is kind of what it is, but we're in a weird time where I think, like I said, if you really think about the long game, you might not make more money up front in private, but you might make more in the end, and you got to think about all that.
High floor, low ceiling. That's and then low floor, higher ceiling going private. Say, you just want to worry about your 9 to 5, get in, get out, and that's it. There's a corporate option for you out there somewhere. And then private, there's going to be a lot more responsibility. And with that responsibility does come more freedom to it, right? And it's that lower floor, higher ceiling. And then the more that you put into it, the more you're going to get out of it. In a corporate job, not necessarily the more you put in, the more you get out, right? They're going to try and get your percentage as low down as possible. They're going to try and get your salary over time as low as possible or fixed. And they keep the salary the same, but they want you to come in that 6th day of the week. Oh, can you come in that Friday? Can you do that? Do you think you can swing? Just give me a morning,
I like my 16 days a month.
I
like my 16 days a month.
Yeah, that's.
I'm like, if I ever go to corporate, I'm like, I got to work like 16 days a month. It's what we do is demanding. It's like grueling, like physically, there's the physical component always kind of bending over, but you're also, a lot of times there's the mental, like you're also sedating someone at the same time. You got to monitor their vitals. You got to like make sure why they're coughing. Are they going to have a spasm while you're doing the surgery? Like there's a lot that goes into it. Put that together. Some of those days are just pretty stressful, right? I think if you're a patient and you have the option to take your daughter to a corporate or private practice oral surgeon, I would go private practice every time. And I'm not saying anything bad about people that work at corporate places. What I'm trying to say is, if you have your own practice and you have some sort of equity in that, like you're in the community, like this is your practice, you're paying rent, or you lease a space or whatever it is, you bought it, you're there. Like, you just can't leave. Like and get another job in another state, because you got to sell, you got to do, like, there's all this stuff that keeps you there. And so like you're more vested in your care, the way you treat patients, the way you how coach your staff and how to take care of patients and manage your own problems, versus you go to a corporate clinic. A lot of times they're just I would say that the attitude is probably different. You have to worry about that stuff. You're going to get paid if you treat them, and who cares if they don't really like it that much or they complain? Like, you're still going to go to work the next day. So you're out of the HR mix there. Unless you're doing something totally egregious, that's different. What I'm just trying to say is, I feel like the level of care and personal care is going to be better. So I feel like for people that are just, taking their son or daughter somewhere and they have that luxury to pick, I would go private every time, just for that reason alone. So if that makes sense.
I agree. I think that does make sense. The only way you win in a corporate environment on that percentage is if you do the least amount of work you possibly can. And the way you win in a private office is to do as much as you can, right? Because you're getting a percentage of as much.
You got to work hard to get your referrals. You got to keep them. You got to keep people happy. You're worried about all that stuff. So it's all part of what you do. Versus, you're working for somebody, you just kind of go to work and, kind of like, all right, I got to go. My time's up. Got to go home. It's 5 p.m.
We went into this job to work with people. We took an oath. Ethically,
I get it, but
it's like what we like, the passion of why we all wanted to go into this. So it only makes sense for that. I think it's like a no-brainer. But
yeah, I mean, there's obviously great specialist surgeons in corporate. I'm not saying anything bad about that. I'm just saying, as a generality, that level of thought makes sense to me.
Yeah.
So
yeah, I agree.
All right, man. I really want to thank you for coming out. Short notice. All right.
That's how we do it. We make time. Thank you.
Yeah. All right.
Man, you're the best.
All right. Later, Bren.
All right, man. Good night.
Bye.